Good evening, everyone. My name is Lotus Marouf. I'm currently a third-year medical student, and I'll be your host for tonight. On behalf of the Training and Development Team and Al Faisal Surgery Interest Group, I'd officially welcome you all to the launch of our brand new series, Mastering the Match. This series is all about giving you real, honest insight into the road of residency directly from those who've walked it. We're bringing in together residents from across the globe to share how they matched into the programs in different countries and specialties, what worked, what didn't, and what they wish they knew. Whether you're starting to explore your options or actively prepping your application, we hope the series becomes your go-to guide. Tonight, we're kicking things off with a country that's becoming an increasingly popular destination for surgical training, Qatar. And we're lucky to have with us Dr. Ibrahim Mohamed, a second-year postgraduate orthopedic surgery resident, to walk us through exactly what it takes to match into surgical residency there. He'll be breaking down the application process, important timelines, and how to build a competitive profile if you're considering Qatar for your surgical journey. Now, without further ado, please give a warm welcome to Dr. Ibrahim Mohamed. Thank you so much, Dr. Ibrahim, for being here. Please go ahead.
Okay, thank you for having me. All right, so just a briefing before we start from what I have already known from you guys. Thank you for the introduction, by the way. So I'm going to give through my talk just a general rule about applying to HMC, or what we call Hammad Medical Corporation, or HMC. So this is the main center of training in Qatar. It could be a bit different than other countries, but here in Qatar we have one single kind of center with multiple hospitals, which all the residents train in. It's called Hammad Hospital or Hammad Medical Corporation. And I'm going to speak about how you guys can apply in this corporation and institute, and the career that you will be able to achieve at the end. Okay, so starting with stock, I have no disclosure. I'm starting right away with the objectives. So the first thing I will speak about the the Qatar surgical residency pathway, the application and the eligibility, the selection criteria, the match day. Hopefully you guys can reach this point. And then the training environment, professional development, lifestyle, and community, the career pathways after the residency. And then by the end of the talk, we could have a small session of Q&A. Anyone who has a question that wasn't addressed during my talk, I'm happy to answer. Okay, so our career start here in HMC, most of us started as internship. So we started here as 1 year of internship, in which we rotated in different specialties like general surgery, medicine, pediatrics, I believe, and we had also some elective and obs and gynecology and some other electives rotations. So in this 1 year, you get to choose or to select one or two electives in which you have in which you can choose your future specialty and your future choice of specialty, and then you can rotate with them. So for me, it was orthopedics, and I rotated with 2 months during my internship. Then I applied into the residency, and now I'm doing my second year. And then you have your fellowship after the residency, and then you have your further career development. You become a specialist, then an associate consultant, or what we call associate fellow, and you then continue as a consultant and furthering your career more. So as I mentioned, for the people who didn't do the internship, so our internship program here is it's very hands-on, and I would really recommend it for any candidate who are actually thinking of applying to Middle East countries or thinking of applying to Qatar. You get a really excellent hands-on experience here in the internship program. So we have 2 periods of application. Usually candidates apply from May to November, and then you get to apply again from November to May. This is the two periods. Then selected candidate will be selected for the first period in the November, and the second period will be in May. And we have two sets. Either you start in the mid of the year in July, or you start at the beginning of the year in January. So this is from, I got it from the website, from HMC medical education website, for the eligibility criteria for students or candidates who are applying for the internship program. So you should have graduated from within the past 5 years of your medical school. Like, it should be as recent as possible. And then you should, for the people who are living in GCC countries, you should have a permit from the GCC countries, or you should hold a Qatari residency permit. The other thing is you should do those exams. So the exams here we have is the IFOM exam. It's the International Federation of Medical Examination. It's equivalent examination to the USMLEs. It's a bit concise rather than like you have a regular long USMLEs questions. You'll have more of a short questions here in your IFOM exams, and you get score out of 60. And the requirement for you to be accepted in the internship program is the minimum of 60 out of 100. Also, you have to have your English scoring system. Either you go with TOEFL or IELTS or IIT. Most of us actually got the IIT. Recently, it's becoming more popular. So carrying on. So the good thing here about HMC is we have what we call ACGME. So the ACGME is the Accreditation Council for Graduate Medical Education. All of our residency programs here in HMC, including surgical and non-surgical residency programs, they have the accreditation from the American College of Accreditations. This is actually very beneficial for us. So basically, there is only, like, I think 2-3 countries outside the United States who their hospitals actually received, or the residency programs received accreditation. So what we get to do is, after we finish our residency program, if you want to continue your training or your fellowship training in the United States, your training will be equivalent of that of a resident doing the residency in the United States. Okay. So if you already completed your period of the internship, now you are applying to the residency program. So there's a couple of criteria that you should think of. The first thing, if you are a graduate, as we mentioned before, if you've already done your internship somewhere else, you should have your internship papers ready. You should have a certificate of completing your internship, or either with us in HMC or outside, and you should been already enrolled in a medical university that is already being accredited by the worldwide accreditation of universities. I already placed it here. Okay, you guys can check it later. Okay, and then the other thing is you should have a valid medical license. So usually a medical candidate or a medical student, after they graduate from their medical school, they will be eligible to apply to medical license in their local countries. So you should guys have your local license. If you are doing your internship here in HMC, you are not required to have your license. It will be automatically provided to you once you get accepted to your residency post. Okay, you are coming also to this point. Also, you are required to get IFOM exam, USMLE, MCC. This is for our colleague who passed the Canadian board examination, Canadian qualification examination. But from our side is most of us actually use the IFOM exam, and here, remember, you have to score more than 72. And I will speak more about it later. Actually, recently we are becoming more of it's becoming more competitive. So you should score as much as possible, not only 72. Okay. So also here you are required to have your English scoring system. You should go with the OIT. That's what I recommend. You should get at least 350 or it is equivalent of B in all your four categories of exam. The listening, the speaking, the writing, and the reading part. Okay. Some of the specialties in HMC requires you to be to have a proficiency and excellent Arabic speaking language. So, like for example, our family medicine program here, because we are dealing with, we know our family medicine colleagues, they are the front line of the primary health care. So they need you to be fluent here in Arabic speaking for the people who are not speaking Arabic. Most of the surgical specialties are not yeah, not holding with this rule. However, it would really be beneficial if you have a good Arabic speaking candidates who are applying. As you know, this is at the end of the day, you are treating an Arabic speaking people. Okay, so our dates for applications for the residency program. Usually, we have three categories. You have the local candidates who are applying, and for HMC, they usually apply in September at this time, and they get their interviews on October. Then the second period starts in which all the international and uh, non-local university graduates they get to apply in November. A period of 1 month, the programs all opens for and the remaining seats you'll get to apply to. And then usually you get your interview in December or January of the next year. And then by the end of March or sometimes April, you will have your matching certificate, and you will know if you already matched to your specialty of interest or you didn't match. So as you can see here, this is also from the same website. This is the seats available for the programs. Okay, so you can see here cardiothoracic surgery. I'll be focusing more on surgical specialties. So cardiothoracic surgery, you have 1 seat available. You have also in general surgery, have 6 seats available. This is in which you get to compete with the local and international candidates. So everyone will compete in those 6 seats. Okay, neurosurgery have 2 seats available. Obstetric gynecology 4 seats. Ophthalmology 3 seats. Orthopedics we have 6 seats. Otolaryngology ENT have 2 seats, and plastic surgery you have 3 seats. And urology also you have 3 seats. So it's quite competitive when you see those very limited number of seats. And we are looking for example, internal medicine, they get like as you can see here, they get really like a large number compared to us, 50 seats. So this makes you to think you should be a very unique candidate when you are applying to HMC. So what is important here? This is the most important thing, is how you can become competitive. And you guys are doing a very excellent work, taking the initiative of having, early on kind of constructive plan toward your residency program, because really medicine is becoming very competitive field to work in. So this is the things I would really recommend you guys focus on. Your clinical research, your clinical experience, your extracurricular activities, just what you are doing right now, and orthopedic related, for whom are interested in orthopedic related courses. So for clinical research, especially in my field now, it's a very crucial. And most of the surgical specialties, we depend in our clinical research for further interventions. Because we always provide intervention for the patient, so we always depending on the clinical research and the literature and the new data are coming in. Also, for you to show us as you are having an interest in the whatever the surgical specialty, orthopedics, for example, you should have a clinical experience. You should show me that, for example, when I see you see your CV or you see in the interview, you should show me that you had already invested a lot of time rotating in orthopedic departments, whatever, in your local country, in your local hospitals. You attended calls with the residents there. You attended surgeries. You have your own case log of surgeries that you attended, your role in those surgeries. And this is actually give a good insight about your interest and about your investment in the field. The other thing is extra curricular activities. So includes whatever you are doing other than your academic studies in your medical university, whatever is important for self-development, because when you are selecting candidates, it's very important to select candidate who is well-rounded person. It's not only about academics and about research only and about your focusing on your academic career, your GPA, your school transcript. Okay, it's very important that you are a well-rounded person. You have a very good social. You are good to work with. You are very social. You have experiences in different places that you can bring in the field. For example, we have a lot of people who actually were doing different specialties before. Or, for example, one of the consultants I'm working with currently, he was an anesthesiologist before, and the other one was actually was general surgeon. And all of them, they came back to orthopedics, and they are amazing, well-known surgeons here in Qatar now. So you could do a lot of things extra. I mean, as a medical student, you could be involved in as I remember, when I was in my medical school, I was involved in the medical office, organizing medical literature, organizing the education for the students, making sure that you attend, like, for example, conferences. Okay, all of this is extracurricular. Okay. Then orthopedic related courses. It's not necessary, but for whom is really interested in orthopedic, I would recommend you guys go with anatomy related courses. Like, for example, Stanford University provided a very interesting and free of charge courses for anatomy related surgical dissections. Also, you have our AO trauma courses. This is courses conducted, I believe, also in Jeddah in Saudi Arabia, once per year. It's a basic course. If you do it, it really shows that you are interested in the field, and it will really boost up your application. So the orthopedic residency program here in CHIPC, we have the fellowship pathway. After you finishing your residency, you have the fellowship. You have trauma fellowship, you have foot and ankle, you have spine surgery, you have pediatric orthopedic surgery. You do it in 2 years, okay? And you have a reconstruction and arthroplasty surgery. You do it for 2 years, and you can carry on after that with the specialty after you finish your fellowship. Okay, so you applied to the match day came, okay, and you matched. You're happy about your match. So what's next? What should I expect if I match in the orthopedic residency program? So this is, as I mentioned before, it's a 5 years program, in which the first year you'll be your introductory kind of and still you are putting your foot in the mud. You're starting to get more of hands-on experience in a real actual orthopedic patients. And PGY, you carry on until PGY 5, in which you become almost like a specialist or a fellow in your teaching your junior residents colleague. So here, this is our trauma center. So what is amazing about HMC and Qatar is we have developed a very excellent trauma one center, one of the best actually in the region. And this actually benefits all of us, in which we get to deal with a lot of different patient nationalities, very complex traumas, people coming from all around the GCC countries and from all around the world actually. And in which so in PGY-1 in your first year, you get to do rotations. Like for example, you go with general surgery for couple of months, and then you do your trauma surgery, in which you focus on complex traumas, abdominal injuries, chest injuries. You also rotate in the trauma ICU. You have also a vascular surgery rotation, in which you rotate to the vascular surgery department. You get to learn how to do perm cath, what is important about vascular repair and complex reconstructions. Also, you rotate with rheumatology. As you know, we have orthopedics. Rheumatology is the other side of the coin of orthopedics. It's the medical side of orthopedics, and you get to rotate with them. You learn about rheumatic diseases and how to deal with it. And then you have your rehabilitation rotation, in which you have to rotate one of the excellent centers in the world. It's called Qatar Rehabilitation Center, in which you see how actually patients with really devastating injury, how they are being rehabilitated, and they are coming back to their normal daily activities. So then in your PGY-2 to PGY-3, you will go to different hospitals. You will start to rotate in general orthopedic trauma, pediatrics. This is our Sidra hospital. It's pediatric hospital, very excellent, well-known pediatric hospital worldwide. And then you go and join, like for example, in third year, you'll go for sport surgeries and sport medicine. You will go for Asbitar, most of you might know it. It's a local hospital here in Qatar that is specialized in sport-related injuries and sport-related medicine. Okay, then you are in your last 2 years. You are focusing here more on pediatric orthopedics, adult reconstruction, and as I mentioned, you are becoming now the teacher for your team. Now you are taking almost the responsibility of all the patients. You are mainly on the theater room rather than you are in the wards or in the ED, and you are doing more of a complex reconstructive surgeries, more of like really kind of complex surgeries. Then you're rotating in like musculoskeletal sarcomas, tumors. I put a just small picture here, as you can see here. We have oncology here in our department is actually amazing. So sarcoma centers also by the way, in Saudi also, it's very great. So it's very rare to have sarcoma centers in many countries. And once you have one very well-established sarcoma center, and it will be very beneficial for you as an orthopedic resident to rotate in if you are thinking in the future to become one of the fellows in the MSK oncology, orthopedic MSK oncology. Okay. So what do you also expect? You should expect to have exams. We have a lot of exams. I just did my Qatar board examination yesterday, and so you have a lot of exams. So you have our board exam, you have your Viva exam, it's done yearly, and you have your OIT exam. This is what I already spoke about. Our American counterpart, our American colleagues, they take the exam with us, and we all are taking the exam at the same day. With the same questions. Okay, so you get to have the same experience and same qualities of training that such really well-renowned world-class training have in the United States. In the United States, you could also have it here in Qatar, and your very amazing local environment, Muslim countries. You get to have both, you know, the benefits, both benefits of having good country, good environment, and at the same time you're having amazing training. Okay, this is our colleagues here taking the Qatari board examinations, just as we did yesterday. So next, this is our environment. Here is this our faculty. We have a lot of them. This is during the Qatari board examination. Here's one of our senior colleagues. He's now a fellow in Canada. He's doing sport medicine. They're doing now here. This is the part that they were doing spine decompression surgery, microdiscectomy. Here you can see you are doing sometime during the day. You are doing reconstruction, knee reconstruction using the Mayo Rebot, and you get to do total knee replacements, hip replacements, very in a very advanced and world-class manner. Okay, so here when our work is divided into the theater, your surgeries, your clinics, and the wards. The clinics, we have our own center here. It's called the Bone and Joint Center, in which you have your own clinic here from day one. So from your first PGY 1 year, you will start to kind of have your own room, your own nurse. You start having some of the patients under supervision, and you're starting to experience, you know, how to deal with actual real life patients, how to examine them properly, how to conduct a well-rounded clinical setting, and how to reach your diagnosis and how to prescribe the medication. And if there is a plan, then you can discuss it with your senior, either the resident or the fellow with you or your consultant, and then you can carry on with the plan. So you are pretty much from the beginning of your training, you're giving this type of independency. So about our achievements in this orthopedic program. So professionally, our department usually we have more than 100 publication yearly by the residents. You have some of the residents who actually established a very interesting navigation system with the AI that help in reconstructive surgery like total knee arthroplasty, total hip arthroplasty. You get to work with local university here to create the algorithms for your program. Also, this is the book that most of the candidates actually study from, who are doing the Arab board examination part 2, the final Arab board examination before you graduate. And it was actually done by our department here. So these are the names of the consultants in our department, and they are the editors and the authors of this book. So you get to do actually a lot of things in your field, not only in orthopedics, as I mentioned before, and most of actually surgical specialties. So it's very important, as we mentioned before, you have to be a well-rounded person. Okay, you should have a balanced, what we call balanced career or lifestyle balance. And sometimes it could be very difficult to achieve, especially during when you are doing kind of like surgical specialties. However, our HMC here, or especially the medical education, it has its own created its own path for the residents to reach the work-life balance. So, for example, you get daily notifications, especially in the beginning of the week. You get daily notifications about promotions, about, for example, activities that will be conducted in through the next year or the next month. For example, we have our own sport, football sport team, our own paddle team. We have you have the vacation and vacation destination. You have, I think, every 2 to 3 months, you will have some notification in your email regarding a vacation destination that is being planned if you are interested to join. And then you get also, very importantly, you get a psychologist, a very confidential type of interaction with them. If you have experiencing a burnout, if you are experiencing any issues, and of course, most importantly, get a very supportive department. So if you have any issues with your training, your own life, you're feeling being burned out, you could actually ask for a period of relief in which you are excused for some time, and then you can come back and continue your training. So it's a very welcoming, warm environment to work in and to learn as well. So this is by the end. Hopefully, you graduated, you finished your 5 years. No, and some of the people here actually also finished the fellowship training programs, and they are actually, most of them, some of them are here, some of them already in Canada, some of them also in the United States doing their further training and fellowships. Okay, so reaching this slide, I have finished already the most important points. If you guys have any questions, any things that I didn't mention, please let me know, and I'm happy to explain more.
Okay, thank you so much, Doctor. That was so insightful, mashallah. Such a well-spoken speaker, and all of the points that you've touched upon are such highly asked questions by the students here at Al Faisal. So we've collected the questions that were sent through a form by our students, and I'll be asking you these questions on their behalf, and we would like to know your answers. So first of all, do you need to have any previous elective months done in Qatar, or you could have done that elective in maybe America if you were interested, or here at Saudi Arabia?
No, actually, you can do elective anywhere. If you are applying to the residency, it's important that you show that they have already done, as I mentioned, clinical experience, but not necessarily to be done here. Many of the candidates actually, and my colleagues, they were like a previous resident somewhere else, or already they did a rotation and a couple of rotations in the United States with orthopedics. So it's really good to have the experience. It doesn't matter where you do it. What will benefit you if you do it here is that you get familiar with the faculty and familiar with the department more. So they get to know you more, that rather than only seeing you at the time of the interview.
Perfect. And the other question is, what are exactly resident programs looking through in students during the interviews and the application process? You've briefly touched upon how a student must be well-rounded and it doesn't only have to do with academics, but could you give us a couple of examples of a model applicant?
Yeah. So so the most important thing is model applicant. So you should, as I mentioned, you should reach the bare minimum, of course, regarding the accepted requirements. Okay. Like, for example, if I'm having a score of 80 plus in my OFF exam out of 100, okay, excellent. But I didn't do the research, I didn't do any courses, I didn't do any other activities. I'm not experienced in, like, for example, like what we are doing now, presentations. I'm not experienced in doing extracurricular activities. When I see such application in the applying to the program, I would kind of go away from it, you know. I'm being focusing on more a person who actually will develop the program more. Okay, so some of the candidates, for example, who were already applied here and graduated from the program, were already doing representing institutions outside. For example, some of them came from Turkey, They were representing orthopedic institutes. They were already medical graduates. They were, for myself, for example, here I was with the Sudanese Medical Association, and I was involved in conducting many lectures and giving education for the upcoming medical students. Also, it really shows that you have a character. That's a very important part. You know, as I just showed you guys, it's only like 6 seats or 3 seats, 2 seats. You should really have a character, and you focus on what makes you unique rather than uh, the other common things.
Okay. And then what would you say is that brings us to like the likability of being accepted? Because it has been a point that has been brought up by students is that Qatar is becoming increasingly more competitive. So would you say the chances here are better than some programs like residency programs in the US?
By far, I know it's competitive. It's really tough to get into, but if you compare it to the United States, it's really rare to find someone who will really match to residency, for especially orthopedics. Maybe general surgery, you have a better chance rather than orthopedics or urology. But it's really like from with the statistics that done in the last year, I think the IMDs were only 2 or 3 candidates out of 900. So it's less than 1% chance of being accepted. But here, if you do your due diligence and you're showing your work, and actually kind of come here at Qatar for a period of like 1 month, and you can do clinical attachment, rotate with the department before the match, see the environment in Qatar, how's the lifestyle here, get in touch with the resident, know the faculty, let them see you, rotate with them for 2 weeks, and then I think you will and benefit a lot from it.
Okay. Now, another question has to do with now the requirements when it comes to the visa. So some students were inquiring upon if a visa is required for application, or is it just once upon you're accepted into a residency program, the program would be responsible for dealing with that?
So I'm not sure to be exact because I'm already a local resident, but I believe from my candidates and my colleagues, they actually don't have a visa. Okay, I mean specific visa provided by the HMC. They usually have their own visiting visa to Qatar, and then the HMC program will change or exchange the visa from a visa to a local residency permit once you are being accepted in the program.
Okay. And another question is if international residents that have matched in Qatar get paid.
Yeah, of course.
Yeah.
Yeah.
Um, Now, another question is among all of the applicants that you've seen, what's the most common trait that they've all had that were accepted into the residency programs?
Common trait. You mean surgically per se or just generally?
The common trait that they had as like applicants, was it specifically they stood out in their research or their character?
Well, everyone is, as I mentioned, is unique. Yeah, like some of them are excellent in research. You know, some of the candidates who I got accepted, they already starting their residency with like 50 or 60 publications. Uh, Super resident. We have another resident who are excellent in their clinical exams. They did their USMLEs, they did their IFAM exams. We have other residents who already just rotated here in the department, and they did an internship, and they really showed their interest in the department, and they got accepted. So it's really, it's a shuffle of different cards and different features for every candidate. But the common rule is the 4 things I mentioned: your examination, your clinical experience, okay, your clinical research, and your extracurricular activities.
All right. And another question has to do with just Qatar in general. Out of all of the countries that you could apply to for residency in the Gulf, what makes Qatar itself stand out?
As I mentioned, it's the only country that is ACG accredited. Okay, that means you are being trained just as your American colleague there in the United States are being trained. The same type of quality, every 3 years, some of the people coming from the ACGME, they assess, or I'm not sure exactly 3 years or 5 years, but every couple of years they come and assess the program. They make sure the residents are being trained the same way. Our exams are the same. And when you are a graduate, when you are thinking of continuing your fellowship in the United States, you are having actually a better of a kind of advantage compared to other people who are just coming, IMGs coming from other regions.
Okay. Um,
And that goes for all the specialties, not
Okay, I think that was all of the questions that we've had for today's session. And I think that wraps up our sessions. Now, as we wrap up, I really want to thank you for being such an awesome speaker and sharing all of your wisdom and your journey. It was really helpful. And I would also like to thank the audience for being such a great audience. Their interaction, their questions were super insightful and added to the conversation. So thank you so much, Doctor. Do you have any last words?
No, best of luck, guys. Just do your best, and at the end, you will be happy if you do your best. Even if you, and God forbid, you didn't get into match, you will get to match somewhere that you'll deserve. Okay, so do your best.
Inshallah. Thank you so much, Doctor. And of course, thank you all for being here, asking great questions, and kicking off the Mastering the Match series on such a high note. For now, until next time, good luck and have a great night, everyone. Thank you so much.
Good luck.